Hello students, today we are discussing another important concept in the abnormal psychology, that is pervasive developmental disorder, or call it as developmental disorder. We all know that across the lifespan each stage is associated with significant problems, and eventually if they are not corrected they may lead certain psychological problems. So, today we are going to discuss autism, which is one of the developmental disorder also called as pervasive developmental disorder. This pervasive developmental disorder or the concept developmental disorder are sometimes used interchangeably, but there may be certain slight differences when we call it as a pervasive developmental disorder or just a developmental disorder. Coming to the autism, in the recent days autism has become a common phenomena among most of the children. This autism is generally traced even before the child is 3 years of age. Now, let us see what this autism is, what are the symptoms associated with this disorder, how we can treat this. Autism is also called as Kanner syndrome or infantile autism. Sometimes a combination of these factors lead to autism, and this autism is mostly seen in boys rather than in the girls. Some factors like family, income, socioeconomic status are not found to be related to this occurrence of this disorder, because some people were of the opinion that this autism is related to lower socioeconomic status or it is related to the lower income groups. But many research studies have indicated that these components like family, income, socioeconomic status have nothing to do with the onset of this kind of a disorder. And autism is associated, or the development of the autism is associated with number of other associated disorders, because in certain cases we see a person or a child with autism is also having the problem of other neurological problems. It is something like it can be related to the seizures or any other neurological problem. So, in certain cases autism is found to be seen in very milder form, whereas in certain cases autism is associated with severe form of mental retardation also. The ways in which autism is exhibited among the children is varying from person to person, from context to context. Sometimes due to certain medical conditions autism is also developed. It is not just related to the neurological problem, but any other medical complications which were found at the time of the birth were also leading to the development of this onset of the disorder. The degree of autism can be ranging from mild to severe. Mildly affected individuals with this kind of a disorder may appear very normal, because it is not completely seen as a full-fledged disorder. So, when it is in the milder form, they just look like normal children, but not as a problematic children with this kind of a disorder. Whereas, in those children where we see the extreme form of the autism, their behavior is disrupted, their body language is distorted, and we also see some impairment of functions which are found as a part of the developmental process. Earlier, researchers were of the opinion that this disorder was developed because of the lack of attachment with the parents. Children like who were brought up without any kind of a proper attachment with the parents were mainly was the main factor for the occurrence of this disorder, and this kind of a belief made the parents feel very guilty that probably they were lacking some parenting skills which was leading to this kind of a problem in the children. However, it was found that lack of attachment with the parents was not the main cause, but it could be the symptom of the disorder. And later on it is found autism is found to be more of a biologically based disorder or genetically based disorder. And to support this, there was much of the evidence available among the practitioners. Autism is associated with many neurological disorders apart from epilepsy or known as seizures. These neurological disorders include tuberculosis and Fragile X syndrome. This Fragile X syndrome is an inherited disorder. Another neurological disorder is cerebral dysgenesis, which means abnormal development of the brain. And another neurological disorder associated with autism is Rett syndrome, which occurs because of a gene mutation. Thus, we can say autism is the result of a final common pathway which leads to many other neurological disorders which affect the brain development. And many studies showed people with autism tend to show the abnormality in the brain size, and this affects the development of the normal brain functions. Another association is strong correlation was found between the autism and seizures. There are two factors associated with it. People with autism were also found to be exhibiting the seizures, and in another condition it is found people who are having this kind of epileptic attacks at a later stage also were found to exhibit this kind of autistic disorder. So, either autism is leading to seizures or seizures is leading to autism. Two things were found in some of the patients. Recent studies have indicated that autism can be attributed to one of the genes which was found on chromosome 13. In some families, autism was found to run from generation to generation, whereas in some other studies it was revealed that autism cannot be attributed to the genetic factors because it was not found in the generations. But surprisingly, many of the siblings were sharing the common autistic features, though autism was not prevalent earlier to the birth of these children. However, researchers are of the opinion that in future we can definitely find out the reason for this disorder by finding out the autistic gene which is causing this onset of the disorder. Now, what are the symptoms of this autism? Look at the slide. Children with autism typically have difficulties in pretend play, social interactions, verbal and non-verbal communication. When we say pretend play, when we ask them to enact the role of a mother, the role of a friend, the role of other child, they cannot enact it because they cannot imagine the situations, they cannot understand the roles of the different people. Apart from this, the other symptoms which are found are they are overly sensitive in sight, hearing, touch, smell or taste. For example, they may refuse to wear certain clothes which are itching because they are oversensitive to any kind of a sensation associated with their body or with their feelings. They have unusual distress when routines are changed. They perform repeated body movements. They show unusual attachments to objects. So, these are the main symptoms which are commonly found in the autistic children. DSM-4 TR also identifies three main categories of symptoms which are found in these autistic disordered children. The first symptom is impairment in social interactions, communication and behaviors. When we say impairment in social interactions, what sort of a behavior they engage in, what sort of a behavior they abstain from interacting, we have to understand this. Impairment in social interaction. Individuals with this autistic symptoms, they fail to develop normal personal interactions which are quite commonly found among the children of that particular age group. Sometimes the impairment is so severe that it may affect the bonding between the mother and the child. The child exhibits complete detachment. For a child, it is very common that whenever the child sees the mother, the child tries to form a good interaction or tries to interact by giving a smile or by trying to show some kind of a babbling. But children with this kind of a disorder, they do not exhibit any of these feelings. Even if the mother leaves the room, they do not cry, they do not show any kind of a distress. So, this is found in the severely disordered autistic children. Other affected behaviors can include eye contact, facial expressions and body postures. Eye contact cannot be maintained, facial expressions are inappropriate and sometimes the body gestures, the body postures are distorted. It is very difficult to understand what they are conveying to say, or whatever they wanted to convey, their body language is inappropriate to their message. Because of this lack of interaction with the people, often these children are left isolated. They feel very lonely and helpless. Another symptom is communication. Communication is severely impaired in the autistic children. It is very difficult for the child to understand what the other person is saying, which we call it as receptive language. And similarly, it is very difficult for the child to express their feelings, which we call it as expressive language. So, the child has difficulty in both communicating and also in understanding. And sometimes in extreme cases, this communication is completely non-existent. They cannot communicate, they cannot babble, they cannot convey the message even through the body language. Deficits in language, the deficits in communication also includes the inability to understand simple directions, simple instructions or commands. Even if you say a 3-year-old child to lift the glass and keep it on the table, they cannot follow the simple instructions. Bring the glass, even the 2 words phrases, it is very difficult for them to understand, or sit, stand. So, they cannot follow even minute simple commands. This indicates that their language or their understanding capacity is highly distorted in these children. Because of their difficulty to interact, the reciprocity is very minimal. Neither they can understand nor they can communicate. So, this restricts their participation in the social activities. Even if the children are trying to communicate, even when they are trying to interact, there is no feeling expressed in their communication. They look very flat, monotonous, as if like there is no emotion, no effect is found in their expression. So, people consider them as very dull to interact or monotonous to interact. People with autistic disorder sometimes repeat the same word again and again or does the same act continuously for a longer time. This is known as echolia or echololia. Sometimes memorization or recitation of songs, stories and other commercial advertisements is very much common. When they see something over the TV, some kind of a jingles, they try to repeat it, or whatever they see, they try to repeat the story or the movie that they have seen, but they do not understand the meaning of it. They just repeat, they just by heart, they just do it, try to recall it by rote learning rather than understanding the content in that. So, when they are able to repeat the words or repeat the song or repeat the commercials, we feel probably they are intelligent enough to grasp, but here there is no question of intelligence because they do not understand the meaning of it. It is just the following or the repetition of whatever they have seen or whatever they heard. So, this is one of the problem associated in their communication. Other communication problems include, look at the slide, they cannot start or maintain a social conversation. They communicate with gestures instead of words, develops language slowly or not at all, does not adjust gaze to look at objects that others are looking at, does not refer to self correctly. For example, says you want water when the child means I want water, does not point to direct others' attention to objects. This occurs in the first 14 months of life and uses nonsense rhyming. These are some of the communication problems. Because they cannot reciprocate, they cannot do the role playing, and because of the improper language development, they cannot maintain their interactions with others, and whatever they want to communicate, they do not communicate using in terms of I, but they try to use the terms of you. Then behavioral symptoms. Persons with autism exhibit a variety of abnormal behaviors. Sometimes they are very hypersensitive to sensory input, that is whatever they see, whatever they hear, whatever they feel through the touch, they overly react, and sometimes they are extremely intolerant to certain noises, sounds and even the visual stimulations. Children with autism, they are fixed with the routine behavioral patterns. Any change in the routine, they cannot just cope with the situation. They want everything in the same order. For one day if you try to break that kind of a routine, it seems very intolerant to them and they show the temper tantrums. So, we have to follow the same kind of a sequence in their daily routines. Sometimes there may also be non-purposeful repetitive behaviors. Why they are showing those movements, hand movements or leg movements or the body movements, they do not have any purpose. They just show the repetition of their inappropriate body movements. Sometimes we see persistent rocking, that is they go on move to and fro for no reason, teeth grinding without any cause, they try to grind their teeth, hair or finger twirling, whenever they are calm and quiet, when there is no other work, if nothing is interesting to them, they normally tries to roll their hair or finger. Hand flapping, that is continuously they try to clap or roll their fingers, and walking on tiptoe, these are some of the common symptoms. Sometimes they are preoccupied with one particular interest, that is one particular activity for longer hours until they lose their interest in that particular activity. Sometimes we see autistic children developing an exaggerated or magnified form of an attachment with certain objects like toys, or it could be a rotating fan. So, inappropriate things which creates a kind of an interest in them, and when you remove that particular object from them, whether it is a toy or any other kind of a string or a piece of paper, they tend to behave very hysterically. Other behavioral symptoms include, look at the slide, acts up with intense tantrums, even to feed them complex activity, gets stuck on a single topic or task, has a very short attention span, has very narrow interest, overactive or very passive, shows aggression to others or self, shows a strong need for sameness, uses repetitive body movements. These are some of the behavioral symptoms apart from what we have discussed. How to identify autistic children or autistic disorder in the children? There are certain signs and certain tests. Generally, babbling has to occur by 12 months. If that is lacking, we have to identify whether it is a normal delayed milestone or is there any neurological defect or any other severe problem associated with it. Gesturing, that is pointing, waving the hand, has to occur by 12 months. If this is missing, this is another sign. The child has to say single word by 16 months, single word, simple words like want biscuit or milk. So, certain words have to be uttered by the child by 16 months. Then as the child is growing, we expect a child to use 2-word phrases, if not the complete sentences, by 24 months. If the child is not showing the uses of this kind of a spontaneous phrases, that is another indication probably the child is lacking something or the child is lagging behind in the milestones. Losing any language or social skills at any age. Sometimes either the child will not show any kind of a skill, or even initially if there is occurrence of or development of any particular skill, as the child is growing, the child starts losing these social skills or certain behavioral skills. So, lack of this or absence of this is another indication that we have to focus what is wrong with the child. Coming to the treatment, an early intensive appropriate treatment is essential to identify and also provide the proper treatment approach in order to help these children and also help the parents in dealing with these children. And most of the treatment programs include a inbuilt programs of different schedules, which helps the children to handle certain tasks at hand. We teach the child how to perform certain simple tasks. We encourage the parents in order to focus on dealing with these children. What sort of strategies can be used with these children? How the child can be taught certain skills. Sometimes visual aids are also used as a part of the treatment, and there are different varieties of treatment, call it as therapies. One is applied behavioral analysis, ABA. Medications is another strategy. Occupational therapy, physical therapy, speech therapy. Depending upon the need, depending upon the necessity, depending upon the intensity of the disorder, we use a combination of these, or we focus specifically on some of these therapies. Sometimes medicines are also used to treat this kind of autistic disorder. Because autistic children also have certain emotional problems, in certain situations we need to use medication to control their emotional tantrums. Some of the emotional disorders associated with autism are aggressiveness, anxiety, attention problems, hyperactivity, impulsiveness, irritability, mood swings, outbursts, sleep difficulty, and certain temper tantrums. So, some children may exhibit all of these symptoms, all of these behaviors, or at least some of them are present in some autistic children. So, to control this, apart from the supportive therapies, apart from the family therapies, we need to use certain tranquilizers and also mood elevators. It was found that diet also helps these autistic children. So, some doctors recommended a gluten-free or casein-free diet, which helps them to minimize certain symptoms associated with the autism. Gluten is found in foods containing wheat and barley. Casein is found in milk, cheese and other dairy products. So, depending upon the complexity of the disorder, if we can make certain changes in the diet which is rich in gluten and which is rich in casein, that is, if we can reduce the intake of these products, certain problematic behaviors associated with this kind of a disorder can be minimized. Apart from the clinical setting, some strategies can be made in certain changes can be made, certain strategies can be used in educational settings. So, when we are using this approach in the educational setting, the treatment goal or the treatment objective should be focused more on enhancing the developmental process rather than trying to focus on the emotional aspects or on the medical aspects. As a part of the therapy used in the educational settings, the class teachers can also be taken as a part of the program, where they are also trained how to respond to the child, what form of attention can be given to these autistic children, how they have to be handled unlike the normal children. So, these tips may help the teachers also in modifying their behaviors and also increasing their patience in dealing with the children. If an adult is having an autistic disorder, that is, if the child is undiagnosed during the childhood and he or she happens to grow up as an adult, still the problems of the autism may be remaining, which may be hampering their normal functioning. So, under those situations, an adult with autistic disorder can be given an occasional therapy as to how to handle his daily routine, or when we give the occasional therapy, certain simple tasks he can be trained in, where he can earn his livelihood in order to support himself, in order to make himself survive without depending on others. That they have to be the first important aspect that the autistic children or adults have to be focused on is interaction and communication. They have to be trained as to how to interact, how to communicate with others. The communication need not be a highly elevated or complex patterns, but it could be a simple way of understanding what the other person is communicating and trying to respond whatever depending upon what the other person has said. So, in creating this kind of an enhancement of the communication, the support of the family is equally important. Even parents have to keep their mind open. They have to see like what are the new approaches, new strategies that are available or that are coming up, and the exposure to this also helps them to handle these people in a better way. The treatment, what sort of a treatment has to be given? The decision of the treatment should be given after the thorough individual assessment, and this decision will vary from patient to patient, from individual to individual. Acceptance of the condition, that is accepting that the child has a autism, is the first important thing for the family. If they are very critical towards the child or towards the adult autistic, naturally the conditions would be more severe, the conditions would worsen more. So, acceptance is more important rather than denying the situation by the family members. Coming to the psychotherapy, we can use the behavior therapeutic techniques which will help them to reduce inappropriate behaviors and increase the most beneficial or useful behaviors, productive behaviors. Behavioristic therapy, behavior modification techniques are proven to be more beneficial compared to other psychotherapeutic methods. Social skills training and support are also essential because it is related to the communication and interaction once again. Cognitive behavior therapy can be used in dealing with anxiety. Because autistic children cannot communicate, cannot interact properly, naturally they also exhibit certain aggressiveness and anger or high levels of anxiety. So, these emotions can be handled in an effective way by using the cognitive behavior therapy. To conclude, in a nutshell, autism is a specific pervasive developmental disorder which generally occurs in the first 3 years of life. It is the result of the abnormal development of the brain and the impaired functioning of the brain, eventually resulting in impairment of interaction and communication skills. Autism is also called as canner or infantile autism. The symptoms of autism vary from child to child. In certain cases, it could be moderate. In other cases, the symptoms or the disorder can be very severe. And what sort of symptoms the child manifests, it differs from individual to individual. The reason for the onset of this particular disorder is an interaction of biological factors, and in certain cases it could also be the psychological factors. The treatment approach should be early diagnosis and very intensive and supportive therapy has to be given. Some of the psychotherapeutic techniques like behavior modification and cognitive therapies can be used. Apart from this, family therapy can also be given to the parents and other family members in handling the cases, in handling these children. In educational settings, we can include teachers as a part of the treatment program, which helps them to handle the autistic children in a more effective manner.